Last winter, I was declined by 5 health insurance companies. I am 26, do my preventative screenings like clockwork, and have no physical health problems. As my boss told me when I started working at a small startup a few months ago that has no group health plan, you're young and healthy. I assume you'll have no problems finding a new plan. I smiled and weakly said, "Of course." 5 applications and 4 declines later, I anxiously awaited my last and final letter. The verdict came: declined. Reason: bipolar 2, ADHD. So there is my secret. Like millions of other Americans, I have a mental illness. When one of our high-profile clients committed suicide last year, for days my coworkers said that they couldn't understand why he would ever feel that way. He was so successful. I sat there mute, thinking about how many times I've been on the edge and how many times I've heard offhanded comments describing colleagues as crazy, schizo, and bipolar. At one point, I mentioned the ADHD part of my diagnosis to a colleague I was close to, trying to test the waters on the mental illness topic. And her response was, "Whatever, you just love taking Adderall," which ironically is the drug I hate taking the most. I realized after that conversation that I wouldn't be mentioning I was bipolar to anyone anytime soon. Good afternoon. What you have just heard is an excerpt from a personal story entitled "Why I Keep My Bipolar Disorder Secret at Work." It appeared in the health section of the Atlantic magazine's website dated August 22nd, 2013. My name is Georgette Fortune, and I will be sharing a presentation with you about bipolar disorder. What do Isaac Newton, Catherine Zeta-Jones, Russell Brand, Winston Churchill, Beethoven, Marilyn Monroe, Frank Sinatra, Vincent van Gogh, and Mel Gibson all have in common? All of them suffered with bipolar disorder. Prevalence. Bipolar disorder afflicts 3 to 5% of the population. Over 5 million people in the United States have bipolar disorder. It is the 6th most common cause of disability in the United States. Suicide occurs in 10 to 15% of patients with the disorder. The average age of onset is 25 years old. During the presentation, we will take a look at the definition of bipolar disorder, types of bipolar disorder, symptoms, causes, diagnosis, treatment, pediatric bipolar disorder, accommodation and teaching strategies. So, what is bipolar disorder? According to the National Institutes of Health, bipolar disorder is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. There are 4 basic types of bipolar disorder. All of them involve clear changes in mood, energy, and activity levels. These moods range from periods of extremely up, elated, and energized, known as manic episodes, to very sad, down, or hopeless periods, known as depressive episodes. Less severe manic periods are known as hypomanic episodes. It is a serious psychiatric illness which affects mood, thoughts, behavior, and ability to function. Bipolar 1 disorder, defined as manic episodes that last at least 7 days, or by manic symptoms that are so severe that the person needs immediate hospital care. Bipolar 2, defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes described above. Cyclothmic disorder, also known as cyclothymia, defined by numerous episodes of hypomanic symptoms as well as numerous periods of depressive symptoms, lasting for at least 2 years, 1 year in children and adolescents. However, the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. Other specified and unspecified bipolar and related disorders, defined by bipolar disorder symptoms that do not match the 3 categories listed above. What are the symptoms? People with bipolar disorder experience periods of unusually intense emotion, changes in sleep patterns and activity, and unusual behaviors. These distinct periods are called mood episodes. Mood episodes are drastically different from the moods and behaviors that are typical for the person. Extreme changes in energy, activity, and sleep go along with the mood episodes. Causes. Scientists are studying the possible causes of bipolar disorder. Most agree that there is no single cause. Instead, it is likely that many factors contribute to the illness or increase risk. Brain structure and functioning. Some studies show how the brains of people with bipolar disorder may differ from the brains of healthy people or people with other mental disorders. Genetics. Some research suggests that people with certain genes are more likely to develop bipolar disorder than others. Family history. Bipolar disorder tends to run in families. Children with a parent or sibling who has bipolar disorder are much more likely to develop the illness compared to children who do not have a family history of the disorder. However, it is important to note that most people with a family history of bipolar disorder will not develop the illness. How is bipolar disorder diagnosed? Talking with a doctor or other licensed mental health professional is the first step for anyone who thinks he or she may have bipolar disorder. A thorough mental status and physical exam is necessary to confirm the diagnosis and to rule out secondary causes, such as medical illness, medications, drugs, etc., of the mood symptoms, particularly in patients presenting with symptoms for the first time after the age of 40. Some bipolar disorder symptoms are similar to other illnesses, which can make it hard for a doctor to make a diagnosis. In addition, some people have bipolar disorder along with other illness such as anxiety disorder, substance abuse, or an eating disorder. People with bipolar disorder are also at risk for thyroid disease, migraine headaches, heart disease, diabetes, obesity, and other physical illness. Proper diagnosis and treatment help people with bipolar disorder lead a healthy and productive life. Treatment. Treatment helps many people, even those with the most severe forms of bipolar disorder, gain control of their mood swings and other bipolar symptoms. An effective treatment plan usually includes a combination of medications and psychotherapy, also called talk therapy. Bipolar disorder is a lifelong illness. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder are free of mood changes, but some people may have lingering symptoms. Long-term, continuous treatment helps to control these symptoms. Different types of medications can help control symptoms of bipolar disorder. An individual may need to try several different medications before finding ones that work best. Medications generally used to treat bipolar disorder include mood stabilizers, atypical antipsychotics, and antidepressants. Pediatric bipolar disorder. At least 1 million American children and teenagers struggle with bipolar disorder, most of them undiagnosed and untreated. In the past decade, there has been a proliferation in the number of children and adolescents diagnosed with bipolar disorder. Except in rare cases, the young people who receive this diagnosis do not meet the strict diagnostic criteria for bipolar disorder 1 or 2 in the DSM-IVTR. Many pediatric psychiatrists insist there are important development differences in the manifestation of bipolar disorder in childhood and adolescence. Children with bipolar disorder are at risk of school failure, substance abuse, and suicide. The lifetime mortality rate for bipolar disorder from suicide is higher than some childhood cancers. Yet children who are stable and have the right support can thrive in school and develop satisfying peer relationships. Recent brain imaging studies show biological differences in patients with bipolar disorder. The disorder affects learning in a number of ways, ranging from difficulties with sleep, energy, school attendance, concentration, executive function, and cognition. Side effects from medications can affect the child's learning and energy. Moreover, while many of these children are uncommonly bright or creative, they often have co-occurring learning disabilities. So what are some of the accommodations and teaching strategies for children with bipolar disorder? The teaching skills that make a classroom teacher successful with typical students are essential when working with children who have bipolar disorder. Flexibility to adapt assignments, curriculum, and presentation style as needed. Patience to ignore minor negative behaviors and provide positive behavioral choices. Most important is the ability to stay calm and be a model of desired behavior. Good conflict management skills to resolve conflicts in a non-confrontational, non-combative, safe, and positive manner. Receptivity to change and to working collaboratively with the child's parents, doctors, and other professionals to best meet the needs of the child. The ability to laugh at oneself and at situations. Teachers who can laugh at their own mistakes and bring fun and humor into the classroom reduce the level of stress that students feel. Students with bipolar disorder benefit enormously from stress-reducing accommodations such as consistent scheduling that includes planned and unplanned breaks, seating with few distractions, providing buffer space and model children, shortened assignments and homework focusing on quality, not quantity, prior notice of transitions or changes in routine, minimizing surprises, a plan for structural time or lulls in the day, scheduling the student's most challenging task at a time of day when the child is best able to perform, allowing for medication-related tiredness, hunger, etc. When developing an IEP for a child with bipolar disorder, educators are sometimes unsure of the most appropriate way to classify the student's special education needs. CABF, Child and Adolescent Bipolar Foundation, advocates the classification Other Health Impaired, OHI. This classification recognizes that bipolar disorder impairs a child's ability to function effectively in school due to impairment in cognitive, emotional, and physical functioning. The behavioral and emotional problems of the student are symptoms of a biological brain disorder requiring pharmacological and psychological intervention, not primarily behavior modification. The OHI classification clearly defines the child's heightened levels of impulsivity, distractibility, sensory integration deficiencies, and poor decision-making skills as being due to this neurological disorder. The OHI classification is an essential building block of vital support that students with bipolar disorder need in order to succeed. The following is a list of family and community resources. Substance Abuse and Mental Health Services Administration Treatment Referral Helpline, NIMH Help for Mental Illnesses webpage. If you are in crisis, call the toll-free National Suicide Prevention Lifeline. Adults and children with bipolar disorder are able to lead a somewhat successful life with the proper treatment and intervention. Thank you.